pay my regards and respect to our director, and obviously to respected principal sir, Prashant Barwal sir, that he has taken another endeavor to organize international webinar, inviting different speakers from the different part of the country. This is the second day. I will speak on some neglected point or neglected subject of organ. Since I am a teacher of organ medicine, so I would like to enlighten the practical part of the organon today in reference to indisposition. The indisposition what is indisposition? Indisposition, as from the organon, I will give another definition. I will interpret it, then another definition, more scientific definition, that is the trivial problems cannot be recognized as the full-fledged disease. Full-fledged disease, slight or trivial, where the serious medical aid is not necessary. Now let us discuss, or let us know, wherein the organon given us idea about the indisposition. What are the sources? Source from the organon medicines. I do not know how many of us read carefully the footnotes. The aphorism 7 footnotes of aphorism 141, aphorism 150. Organon not a theoretical subject. Entire organon is a practical one. Hahnemann, what he did in his practice, after discovery and before discovery of homeopathy, he wrote the organon in a aphoristic style, and every aphorism has his practical approach and clinical approach. Naturally, we should study the aphorisms along with the footnotes. Aphorism, as we know, the defines, always I try to speak in this tune, it is a short statement which is more than that of an elucidations. You know the amplification in Maharashtra, in Marathi language, only one word is written. When you amplified it, explain it, you may write 100 of pages, 200 of pages for the amplification of a single word. जब गीता में जाओगे, जब कुरान में जाओगे, जब त्रिपिटक में जाओगे, देखो only one sentence has been written over there. Only one people. So we have to interpret it. Short pithy statement which is more than that of an elucidations. जो हम जानने चाहता हूँ, जो बता दिया है, जितना मैं explanation देना चाहता हूँ, so that is not काफी. It is more than that of that. So Bible हो, Quran हो, Gita हो, it needs some explanations. When you go to the mosque, that the Imam or that who know the Quran, when explain it, you convincingly, magically you try to understand. Similarly, the organon, the same aphorisms are the short pithy state. It needs the explanation, and it is the duty of a teacher to explain what Hahnemann wanted to see in this way. And the footnotes are short notes, which is written usually at the bottom of the page, which needs the explanation of the main text or aphorisms, and full of explanations, exemplifications. There is a proverb in English, as you know, the example is better than precept. That means what you say, if you example it, give some example, the organon is full of examples. That examples, these are related. When you go to the secondary counteraction, primary action, Hahnemann has nicely given his exception, 63, 64, 67. And footnotes, he has compared the secondary action with the dungeon and different ways he has tried to explain it and giving some examples. So example is better. Smoking is statutory warning. written in the cigarette box. So it is the precept. What will be the examples? Because it's the practical way that smoking is the source of so many diseases like cancer and others. So naturally, we have to give some example in certain way every part of the autonomous medicines. There are three sources. Wherein you find, wherein you observe, the word aphorism has been written, aphorism 7, aphorism 41, 141, and aphorism 150. Then if you go to the text of the aphorism 7, what it said, very important aphorisms. Practically, it is very important because of that, though theoretically we know that it is a theoretical part, no, it is a practical one established on the basis of theoretical ones. There are so many people who want to join. Anyhow, now as in disease, from which no manifest acting or maintaining cause, causa occasionalis, has to be removed. There is a footnote. 3. If you open the organon, you will find there is a 3, and 3 has interpreted it in the footnotes. So what is that? When there is a manifest exciting cause or maintaining cause? What is manifest exciting cause? Manifest means it is visible, palpable, perceptible, and that is removable. जहां पे कोई manifest exciting cause नहीं है, उसको तो क्या करेगा? And which is maintaining cause नहीं है. If there is a such manifest exciting cause and maintaining gas, you have to remove it. We have to remove it. Otherwise, we cannot proceed to take a case and cannot proceed to do the treatment with homeopathic medicines. Carefully, Hahnemann said it. And very serious matters, that the causa occasionalis. When there is a word, there is an opposite word. What is causa occasionalis? The occasional cause of the disease. It is not the regular cause. It is not the fundamental cause. That is not the real cause of disease as per orthodox medicine. So causa occasional, what is the causa? What is the causa? Opposite cause, opposite term of the causa occasionalis, that is the causa sine qua non. What is the meaning of the? Both are the Italian phrase. Both are the Italian phrase. I thought about the matter. From where Hahnemann has taken that particular causa occasionalis, and then I consult so many dictionaries and others. The opposite term is causa sine qua non. What is the English meaning of that? That is the real cause, fundamental cause. That's the essential cause of the disease. In our parlance, हम लोग को इसको कहता है miasmatic cause. So apart from the miasmatic cause, the real cause of the disease, as Hahnemann established. Today we would not like to discuss about the miasm. Simply, I will try to discuss about the causa occasionalis, especially in reference to the footnote. The aphorism 3, aphorism 7, you find the 3. So manifest exciting cause or maintaining cause, and other one is the, if you go through the aphorism 5, there is another cause. There is an exciting cause, most probable exciting cause. What is the meaning of that? Later on, if I get time, I will discuss about the most probable cause. What is the necessary to understand the most probable cause in aphorism 5? So that is very important to us. So in aphorism 5, he has explained about the fundamental cause also. Today, I will discuss that the footnote 7, as Hahnemann referred the footnote 7, the indisposition word, you will find that an intelligent physician, the intelligent physician will remove
Sir.
sound is coming. Hello. Sound are coming. Don't disturb us. It is not necessary that every intelligent physician should first remove this where it exists. जहाँ पे वो maintaining cause, जहाँ पे है वो manifest exciting cause, that is visible, that is perceptible, that is removable. First intelligent physician उसको हटाएगा. You will remove it. The indisposition thereupon ceases spontaneously. Automatically वो indisposition जो आप लोग कहता है slight disposition, slight maybe not a disease, fully fledged disease, not a disease, the हटे जाएगा. Therefore, he has given so many lot of examples here. So I have told you, the examples are better than precept. example is better than precept. So naturally, he has given so many examples to understand the particular terms of the aphorisms, these aphorisms. First example he told, he will remove from the room strong smelling flowers. Strong smelling word has been deleted over here during typography. It is a typography mistake. Flowers which have a tendency to cause syncope and hysterical sufferings. There are so many patients we find in practical life, even in social life, that some patients told in the same family, in the same 5 brothers and sisters. One brother says, Papa may cannot smell these flowers. उल्टी आ जाता है. मैं ज्यादा टाइम के रहेगा तो हमको फेंट हो जाएगा. हमको, and sometimes you observe that hysterical suffering. And what animal told? Please remove it. Yes, in practical life, we student, in our practical classes, somebody enters, that there was the ammonia gas. And when he enters, by smelling the ammonia gas, he will be, I'm feeling trouble, please get rid of it, उनको निकाल देना चाहिए. ऐसे कुछ practical experience आपको मिलेगा. You will get it from the practical life. So what Hahnemann said, you first remove it. Then automatically the condition arises about in the small smelling flowers, small smelling paints. Asian paints का इतना small smell आता है, कुछ paint का इतना smell आता है. जो आप wall में देता है 2 दिन, 3 दिन, 3 days or 4 days, you cannot enter in the room, and somebody cannot enter even because of that smell causes syncope and hysterical sufferings. And thereafter, he has explained the cornea, the foreign body that excites inflation of the eye. When there is a foreign body, sometimes stones, pebbles, or some dust has been fallen into the eye, it will produce inflammation. I will give the example how we will remove it. Already I've taken so many classes or in the first year, second year, I interpret it. They extract from the cornea, the foreign body that extract inflammation of the eye. How will you expect it? Did Hahnemann given any practical approach of it? No, it is our duty. It is a duty of the teacher to explain how he will explain. I will explain later on. First, let me discuss the examples, what he has written in the organon medicines in the footnote. Loosen the overtime bandage on a wounded limb that threatens to cause mortification and apply a more suitable one. Lay bare and put a ligature on the wounded artery that produces hunting. Yes, we see that overtime bandage, इतना ज़्यादा जोर से उसको टाइट कर दिया. हाँ, क्या हो सकता है? The dependent part will be defied of blood circulation, and owing to that, whatever one that mortification may cause, that the gangrene may produces, that may decomposition produces as per your common pathological changes you find. So naturally, you have to lose it. You find, doctor साहब देखिए ने, हम वो दूसरे डॉक्टर के चला गया, वो इतना जोर से कर दिया, यहाँ देखो ना, वो जो डिपेंडेंट पार्ट है, अंगली के कोई सेंसेशन नहीं आ रहा है, लगता है ब्लू हो गया है, लगता है पेल हो गया है, ऐसे उसको अपना लैंग्वेज से बताएगा. You first it loosen it, otherwise it will turn into disease, it will turn into mortification, it turns into gangrene and other trauma. And thereafter, as an intelligent physician, you have to give one more suitable one and lay bare to put a ligature on the wounded artery that produces fainting. Sometimes what causes? By blood. Just खून देखने के बाद ही उनको फेंट आ जाता है. ऐसे होता है, फेंटिंग हो जाता है. उनका अपना खून देखने के इतना खून चला गया, इतना खून जो फेंट हो गया. ऐसे नॉर्मली पेशेंट कुछ देखता है. जस्ट आफ्टर ब्रूचर होता है, जहाँ पे होता है वहां पे क्या होता है, खून निकल के फेंट हो जाता है. So that should be, sometimes it happens in the practical life, and we see. So this has some practical part. What Hahnemann said, you please do it. You please do it. Don't think these are the serious disease, but it is a slight indisposition. Intelligent physician, someone, Sufyan Ahmed is traveling over the screen. Sufyan Ahmed, don't scrabbing on your probably your Android phone. Don't scrabble. Next, endeavor to promote the expulsion by vomiting the belladonna berries, etc. That may have been swallowed. Sometimes belladonna berries, कुछ ओ खा लिया, So what to do? You have to try to vomit कर दे सकता है. Intelligent fast, because the belladonna berries may produce serious diseases, that tendency to serious diseases producing. So immediately first उसको निकाल लो किसी तरीका से, by mechanical or by giving some another thing which is used as emetics, and that should be produced anemia से कर सकता है. Is it allowed? Yes, Harivan said these are allowed. No problem of that. So next, extract foreign substances that may have got into orifices of the body, the nose, gullet, ears, urethra, rectum, vagina. जो फॉरेन सब्सटेंसेस कुछ हो जाता है, नाक पे घुस जाता है, कोई पेशेंट आपका पास आएगा, डॉक्टर साहब देखिए ना, वो खेला करते गांव में आपका जो प्रैक्टिस करेगा, इवन इन टाउन, इन सिटी, नागपुर सिटी और एनी पार्ट ऑफ द कंट्री, इफ यू प्रैक्टिसेस, और रूरल एरियाज और अर्बन एरियाज, व्हाटएवर मैनेट, ऐसे पेशेंट आपको क्लिनिक में आ सकता है, डिस्पेंसरी में, डॉक्टर देखिए ना, वो तो खेला कर रहा है, वो लड़का वो नाक में कुछ चला गया. तो इंटेलिजेंट फिजिशियन व्हाट विल डू? इट विल ट्राई टू रिमूव. कैसे करेगा हम बाद में डिस्कस करेगा. गले में कुछ चलेगा, गालेट में क्या करेगा, हाउ यू हैव टू डिस्कस इट. कान पे देखिए ना, वो चिट्टी घुस गया, हाँ, वो कैसे करेगा, देखिए ना, वो खेला कर रहा है, गांव में होता है ऐसे. द एंट हैज बीन एंटर्ड इनटू द ईयर्स, सो हाउ टू रिमूव इट. डॉक्टर से वो रात से चिल्लाता है, देखिए ना, ऐसे कुछ पेशेंट हम लोग देखा है, छोटा कॉकरोच का वो घुस गया उनमें में है. यूरेथ्रा भी हो सकता है, बच्चे लोग खेला कर रहा है, ऐसे खेलने के ऐसे तरीके से कैसे यूरेथ्रा में कुछ अंदर चला गया, रेक्टम में क्या चला गया, ऐसे होता है, भेजाने में चला गया, क्या होगा. These are the foreign substances. These are the manifest exciting cause, and manifest exciting cause are visible, palpable, perceptible, and removable. These are the four conditions. Immediately, being an intelligent physician, please try to remove it. Next, another very beautiful thing, Hahnemann, written in the orthodox medicine, cross the vesicular calculus. What a funny thing. Being a homeopath, we have to cross the vesicular calculus. Hahnemann wrote this particular sentence in aphorism 7, 210 years or 200 years back. Mind that. There was no lithotripsy during that time. There is no anything more what we use during present time by mechanical procedures. Lithotripsy, there are so many things. But during that time, he told, cross the vesicular calculus. How he applied, thought about the matter. 200 साल पहले वो लिखने गया, that was in the 1810 he wrote, or with the additions. So we have to think over the matters. Next, open the imperforate anus of the newborn infant, etc. So हमको etc. का डिस्कस करने पड़ेगा. पहले हम जो डिस्कस करेगा आपको बारे में, जो फर्स्ट क्या, एक फॉरेन बॉडी कुछ निकल गया आंखों में. डॉक्टर साहब देखिए ना, हम तो वहां पे सफा कर रहा है, वो जो डस्ट पार्टिकल्स हमको निकल अंदर में गिर गया, क्या करेगा. देखिए ना, कानों में कुछ आ गया. ये तो एवरी टाइम आई हैव डिस्कस्ड ड्यूरिंग माय रेगुलर क्लासेस ओवर देयर टू द स्टूडेंट्स, दोज हु हैव टेकन पार्ट इन माय क्लासेस. नेक्स्ट, गले में कुछ चला गया, नाकों में कुछ चला गया, आंखों में क्या करेगा. आई थिंक यू नो, आंखों में जस्ट यूज द potable water. Repeatedly give the water. Repeatedly wash it. The foreign body will remove. Please, it is the practical one. Please, my students and teachers also knows the facts. No, फॉर्मेलिटी निकल गया, सालिशिया दे दो, फॉर्मेलिटी कुछ देने के लिए कुछ मेडिसिन दे दो. It is not a serious disease, but there is a big part. Somebody tells, डॉक्टर, हमें जब आंखों में कुछ गिर जाता है ना, वो लाल हो जाता है, पेन होता है, ऐसे कुछ. लेकिन देखो ना, मेरे दूसरा बच्चा का, मेरे वो दूसरा सहेली के कुछ नहीं होता है, वो बहुत बार निकल गया, बहुत बार गिर गया, लेकिन कुछ ऐसे पानी से चला गया. So somebody are very susceptible to the particular stimulations and somebody are not. That we know because of the susceptibility, which bar susceptibility, we cannot predict it, but when you experience, डॉक्टर नहीं मैं जाएगा, इससे हो जाता है मेरे. तो आंखों में when any foreign body drop into, what you will do, you have to wash it, repeated washing by potable water. not by that water is not usable, that water is not potable, means that is the better to say it is the palatable, and that is the can be used as the pure waters, pure waters, not the impure waters. You have to. Next, कानों में कुछ चला गया, चिट्टी घिस गया, कॉकरोच जो होता है आप जो लोग जानता है घर में रहता है, वो उसको कुछ निकल गया और दूसरा कुछ फॉरेन बॉडी गया, कानों में कैसे करेगा? हाउ? फॉरसेप्स? नो। एनी अदर थिंग? गांव में क्या करता है, वो में मस्टर्ड ऑयल दे देता है, ऐसे ऐसे कुछ हाइड्रोजन पेरोक्साइड ऐसे ऐसे दे देता है, थोड़ा काम करता है हाइड्रोजन पेरोक्साइड, लेकिन यू हैव टू डू द ओनली सर्जिकल प्रोसीड्यूर्स, that is by syringing. By syringing, it is a technical, practical part. I think the principal will take endeavor to train our interns or train our doctors to supply by supplying these ENT sets. कैसे तुम syringe को, it is the department of surgery responsible for that, not a surgery. Homeopath doctors, he should learn it, he should teach it in during their classes, that how, if देखो हम तो BHMS है, ये तो सब भी बैचलर ऑफ होम्योपैथिक मेडिसिन एंड सर्जरी का नॉलेज भी है, सो यू हैव टू सिरिंज इट. हाउ विल सिरिंज इट? कैसे? इट्स अ टेक्निकल, इट इज एन आर्ट, एंड प्रैक्टिस मोर एंड स्किल intensifies by practice exercises. You do it, otherwise if you push the syringe very slowly, you have to push it. पानी देने सकता है तो ड्रिंकिंग वाटर, पोर्टेबल वाटर, धीरे धीरे जब जाएगा, otherwise if you give it forcefully, that टिम्पनिंग में मेम्ब्रेन विल बस्ट आउट, ये दूसरा डिजीज हो जाएगा, केयरफुली कर सकता है. नाकों में कुछ चला गया, नोज फॉरेन बॉडी गिर के हो सकता है, जाता है, वो वुड पेंसिल को वो बच्चे लोग अंदर में चला जाएगा. गांव में प्रैक्टिस करता है, शहर में करता है, क्या करेगा आपको? तो वहां पे मिलता है क्या? फॉरसेप्स? नो, फॉरसेप्स विल नॉट टेक एन इफेक्ट ओवर हियर. The ENT specialist knows it, surgery knows it. You have the ENT sets. There is a prop. There is a prop is needed, that you have to put it slightly by side, and when you find the aid by torch, you have to, and by just pull down the lever, automatically this will come out. So this is a technique you have to apply. Being an intelligent physician, how to remove it? An intelligent physician should know it. How to remove these particular foreign body entered into the orifices. So ear, nose, eye, gullet, fish bone. आप लोग तो फिश नहीं खाता है, कभी कभी खाता है, जो खाता है जानता है, छोटा छोटा फिश बोन अंदर में चला जाता है. नहीं सर डॉक्टर, हम तो पहले हैनीमैन क्या बताया, प्लीज रिमूव इट. इवन द गैलेट, गैलेट में क्या होगा? गैलेट में आपको यू हैव टू रिमूव इट बाय द यूज ऑफ द फॉरसेप्स, बाय द यूज ऑफ द फॉरसेप्स. नो नो डॉक्टर, हमारे होम्योपैथिक बहुत ज्यादा औषध है, वो चिट्टी घुस गया तो क्या करेगा? हम ऐसे फॉरेन बॉडी वो ऐसे दवाई दे देगा, तो कुछ दिन पहले क्या होगा, किस दिन पहले वो पास हो, इन्फ्लेमेशन हो जाएगा, पास हो जाएगा, पास निकल जाएगा. हाँ, पेन होगा, सीवियर पेन होगा, इवन में सेप्टिक टर्न्स दूसरा डिजीज कॉम्प्लिकेशन हो सकता है. फर्स्ट इंटेलिजेंट फिजिशियन, प्लीज अप्लाई द मेथड्स by which can remove these particular things when enter a particular places of the orifices. यूरेथ्रा में कुछ चला गया, कुछ किसी तरीका से एक्सीडेंटली बच्चे लोग के चला गया, क्या करेगा तुम? How will remove it? You have to follow the technical procedures by the urethra. But tried by forceps? No, not by forceps. If necessary, as a BHMS, as the ACE is there, apply the technical procedures with the surgical opportunity. ऐसे करके निकल सकता है, धीरे 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 ऐसे कर सकता है. यूरेथ्रा में, वेजाइन में चला गया, वेजाइन में कुछ गिर, इससे हो सकता है एक्सीडेंटली किसी को हो गया. You have to remove it by the forceps and others. आपको रिमूव कर सकता है. नेक्स्ट, ऐसे बहुत सारा जो एग्जांपल हैनीमैन दिया है, that should be रेक्टम हुआ, वेजाइनम में हुआ, यूरेथ्रा, ईयर्स हुआ, गैलेट हुआ, नोज हुआ, एंड आई हम बता दिया. Now make discuss. Sir, you are telling Hahnemann has told it is not a disease, but trivial cause. But that trivial cause is very dangerous. The trivial cause, because of the susceptibility, you do not know when you turn to the disease. I have given examples. So what will be the exact definitions? What should be the exact definitions? It is a state or condition which hampers the normal physiological phenomena. Again, I repeat that it is a state or conditions which hampers the normal physiological phenomena. An intelligent physician's duty to start the normal physiology. Otherwise, it may turn to the pathology. How, sir? आंखों में कुछ निकल गया. What it may turn? If it remains, I do not know the condition of the patient. I do not know the time which requires to turn into the disease. Immediately, what Hahnemann told, immediately remove it. What happens? The physiology hampers in the eye. Vision is hampered. Sir, कुछ नहीं देखा ही नहीं जाता है. देखो ना पानी निकलता है सर, पानी निकलता है. आंखों में पेन भी नहीं है, लेकिन ऐसे कुछ सेंसेशन है, ग्रिटी सेंसेशन है, कुछ नहीं ऐसे गिर जाता है जब, तो vision चला गया. चला गया means that is hampered. Physiology is being hampered. कानों में, जो उस कानों में गिर गया को anything foreign body, there's a buzzing sensations along with the sir. ये सुना ही जाता नहीं कि ऐसे आवाज होता है, रात में ज्यादा होता है, रात में ज्यादा होता है. Physiology being hampered. नाकों में, only one nostril there is only has been affected by the some foreign bodies. सर ऐसे सांसों का कुछ प्रॉब्लम होता है, ये वो नाक बंद है तो ये नाक में निकलता है. जैसे हमारा कफ एंड कोल्ड होता है, स्टफीनेस ऑफ द नोज में होता है सब physiology being hampered by taking the inspirations. गोले में कुछ निकल गया, गिर गया, क्या होगा? डॉक्टर हमें डिफिकेशन होता है. कैसे डिफिकेशन होता है? सॉरी, क्या होता है? डिग्लूटेशन में प्रॉब्लम है. सो कानों में भीषण, कानों में ऑडिशन, आंखों में क्या भीषण, एंड गोले में डिग्लूटेशन हो जाता है. तो ये आपको फिजियोलॉजी हैम्पर हो गया. यूरेथ्रा में मिक्चुरेशन, रेक्टम में डिफिकेशन, वेजाइना में मेंस्ट्रुएशन भी प्रॉब्लम्स कर सकता है. एनी फॉरेन बॉडी, देयर इज अ टफ हाइमेन. व्हाट हैपेंड? टफ हाइमेन, व्हाट हैपेंड? By some congenital anomalies, there's a tough hymen, the menstruation being. What to do? We have to, by homeopathic medicine, what Hahnemann tells, that you take the advantage of that, if possible, if required. Your knowledge as being a surgeon, homeopathic surgeon, you just tough hymen can be open, and 10 tough hymen can be, that hymen can be ruptured by mechanically. Otherwise, the menstruation will start. So my definition, I think, all the points are covered with a state or condition wherein the physiology is hampered. An intelligent physician's duty to start the physiology. Intelligent physician's duty to start the normal physiology. What? Who told? Hahnemann has told. It is not my word. It is my duty to interpret it. As my student may ask, sir, आप क्या करता है, क्या बात करता है? बोले देखो physiology hamper होता है. So we have to start the normal physiology. Otherwise, it may turn to pathology, full-fledged disease हो जाएगा. Next, open the imperforate anus of the newborn infant, etc. Imperforate anus, congenital anomalies हम लोग मिलता है, देखा है. डॉक्टर साहब देखिए ना, 2 दिन से मेरे बच्चे को कोई टट्टी नहीं हो रहा है, स्टूल नहीं पास किया है. तुम तो कभी चेक भी नहीं किया, कब से नहीं किया है, बहुत हिस्ट्री ले लिया. क्या वो क्या पिया है, what he ate, what he drank. ना डॉक्टर तो अभी तो ब्रेस्ट मिल्क पीता है, लेकिन उसको मामी क्या पिया है? डॉक्टर साहब मामी का होम्योपैथ, मामी का है, मामी का होगा तो उसको बच्ची को हो सकता है. हाँ हो सकता है वह ब्रेस्ट. कोई में ऐसे खाने के लिए टट्टी नहीं हो रहा है बच्चे के, वो भी दवाई दे दिया, कोई नक्स भूमिका दे दिया, कोई जो सिम्टम आएगा मामी ऑन द कंसिडरेशन ऑफ द मदर, कुछ नहीं होता है. लेकिन कभी फिजिकली इंस्पेक्ट नहीं किया जो उनको एनास का परफोरेशन नहीं हुआ है. परफोरेशन ही नहीं हुआ है. First, you inspect the patient. Carefully inspection. You observe it. Newborn baby. Stool is not passing last 2 days, 3 days. Patient giving pain, rising pain out of arising pain. What happened? Screaming. Feeling discomfort. So first you inspect this one. Yes, there is an anus. Is a medicine you will apply at that time? No. We have the Myasing meeting medicine. You have to take the case, mother's history, father's history. They say leke. Ultimately, it is the congenital medicine. I will give the syphilinum 1M or syphilinum 2M. What any man told? An intelligent physician first start the normal physiology. Because of that, the impacted stool, what happened? So many pathology may starts. So if you inspect and if you observe there is imperforate anus, please, with the help of surgery, you have to open that anus. Otherwise, stool not coming partially out. If you think no, homeopathic medicine, don't. It is not my saying. Hahnemann himself told in organon medicines, this is the practical approach. You have to learn how to do it. Whether I will refer the case to the surgeon, whether I will refer to the case to the hospital, or I will do it in the Antarbharti Homoeopathic Medical College with the help of our. Are you entitled to it? Yes. My organon says you are entitled. Hahnemann never said you refer to the case to the allopathic surgeons or like that. Why you are getting the qualifications of the BHMS, Bachelor of Homeopathic Medicine Surgery? That part is a separate the true surgical and for surgical. Sometimes we consider the for surgical as a true surgical. There's a interpretation is quite different, separate. So you do it yourselves with the practical knowledge, with the help of the OT, if requires. No OT is required here, there. Simple operations, if perforate one. And etc. What are the etc.? डॉक्टर मेरे बच्चे देखो 5 साल हो गया, ये ज्यादा वो रान करता है, ब्लू हो जाता है, बहुत दवाई दिया, ब्लूनेस ऑफ द स्किन, ब्लूनेस के बहुत लैकेसिस, बहुत दवाई दिया, नहीं डॉक्टर कुछ फायदा तो नहीं हो, तो वो तो जब वो दौड़ता है, रान करता है, तो उनको ब्लू हो जाता है. प्लीज थॉट ऑफ द persistent foramen novel. No, I have got medicines, good medicine. I will give the persistent. जो perforation है, वो इंटरैक्टियल सेप्टम, वो जो डिफेक्ट है, वो ठीक हो जाएगा. Don't claim it. जहां हम लोग सभी केस हमारा होम्योपैथी हो जाए, कैंसर टू कफ एंड कोल्ड. This is not what the matter. Hahnemann told that intelligent physician first और जो persistent foramen novel etc. का interpretation हम दे रहा है. You have to take the help of the surgery. Otherwise, that foramen novel, accident is accident. Miracle is miracle. कभी हो सकता है, कभी नहीं हो सकता है. Miracle does not happen all circumstances. But you have to consider the sayings of the organon medicines as said by Hahnemann. So that etc. foramen novel. Ductus arteriosus. You know from the congenital anatomy. Chaudhary sir hai yahan pe जरूर anatomy के teachers. You have to take the help of the surgeon. If we do allowable, yes, that should be trained. Our teacher students should be trained. Why not? Hahnemann never said here, you please refer to the case to the modern medicine or like that. Though there is no modern medicine at that time. Because of that, Hahnemann himself or the doctor mean the full-fledged doctor with the knowledge of the surgery and everything. Not only the medicines, all the things. So my students and participants, these are the examples Hahnemann has given over here. Open the imperforate anus, newborn infant and etc. That newborn infant with congenital animal is like foramen novel, ductus arteriosus, and so many congenital things we see in our practice life. Try to remove it, try to repair it, if possible, if necessary, you take the advantage of the surgeon in your institution, in your clinic, and if you are expert, become an experienced one, then you please apply your knowledge. You are entitled to do it. There is no bar at all. So, indisposition is a state or condition which hampers the normal physiology, and other is the cross the vesicular calculus. I thought about the matter. Hahnemann wrote this particular word 200s or 100 or something back. Cross the vesicular calculus. I contemplate on that particular word. अभी तो लिथोट्रिप्स है, बहुत सारा टेक्निक है, वहां पे क्या था, ऐसे कुछ क्या यूज करने के उन्होंने बताया। हनीमैन तो कोई यहाँ पे होम्योपैथी मेडिसिन देने का तो नहीं बताया। बोले क्रॉस करो, इंटेलिजेंट फिजिशियन विल क्रॉस इट। No, I will not give Barbaris valgulus. Shall I give any other medicines for the so many medicines for the calculus? Hahnemann never said that you please take the advantage of the real medicines or other, but he clearly stated that cross it one. It depends on the size. In a trigon of the bladder, if there is a huge size of the calculus, it will not pass out through the urine. Urethral opening is so much, internal meatus is not so much large than that of the vesicles. You have to cross it. With the facial forceps or any other surgical procedures, you may cross it. When our modern technique are there, lithotripsy by sound, etc. Why should I? So yes, why not? You have given a lot of medicine, considering the miasms, considering the symptomatology in totality, the symptoms, miasmatic totality, and the things, the medicine does not affect. How long the patient will wait? इतना size हो गया, urine micturition बंद हो गया है. You please take care of it, and we please should take care of that particular. Otherwise, it will produce pathological symptoms. Another is क्या? ऐसे हम लोग देखा है, कैंटीन में वो प्ले कर रहा है. In my student life, suddenly my colleague, friends, got pain in abdomen, severe pain. And we referred, and he brought the patient, our friends, to the nearest medical college. That is the very popular nearest medical college at Calcutta. Severe pain. And ultimately they diagnosed it is a case of peptic ulcer perforation. पहले तो अब दे दिया वहां पे, बेलोडोना दिया, सिचुएशन देके कोलोसिन भी दिया है, जो दवा है सिम्टम के दिया, कुछ काम पे कुछ फायदा नहीं हुआ है. डायग्नोस हो गया पेप्टिक अल्सर परफोरेशन. सिम्टम पेप्टिक अल्सर परफोरेशन के है, धीरे धीरे आ रहा है, माइल्ड है, अभी पेरिटोनिटिस नहीं हुआ है, फीवर भी आ रहा है. उसको पहले इंटेलिजेंट फिजिशियन should consider it and refer to the particular areas. Peptic ulcer perforations, you have to take the help of the surgery. If you think that homeopathy medicine will act on that symptomatology, miracle not always happens. Accident never always happens. It is not universal. It is the particular, depends on the susceptible condition of the patients. Condition of the patients. You have to take it, the knowledge of it. Now, how will divide the indispositions? Myself thought about the matters. It is a very serious matters. It is indisposition. No, it is a serious one. A very important one for us, for the health. That indisposition may occur by some outer external cause. What are the external mechanical cause or outer mechanical cause? जैसे कुछ फॉरेन बॉडी गिर गया, कुछ घुस गया अंदर में. These are not internal, these are external one. These are the external cause. These are manifest, removable, perceptible, palpable. But another one, I thought about the matters. I'm telling because I consult this one, I taught like this way for the practical purposes of organon. Each word needs interpretations. Other is the internal dynamic cause. The vesical calculus, persistent ductus atreus, foramen ovale, are they originated from the external cause? No, internal dynamic cause. The dynamic pathology was there. The dynamic pathology may considered congenitally due to some miasmatic cause. But the symptomatic, until and unless the symptoms is there, we cannot treat it because we consider all the things in the myasthenics. So this vesical calculus, it is due to the dynamic pathology, not the external cause, like examples I gave you, Hahnemann gave you here. It is the internal pathology that vesicle is formed, not in a 1 day, not in a 2 day, but we cannot perceive it. Ultimately, it turns to such a size, the micturition may be stopped. Foramen ovale, that is also the internal dynamic pathology. Persistent ductus atreus, it is also the cause. Cave palate, hard palate, you know, cave palate. Is there any medicine? Otherwise, patient is feeling a lot of difficulties, phonescence and etc. Speech का problem होता है. नहीं सर, बहुत सारा हमारा स्टेमरिंग हो सकता है. लेकिन जहां पे है प्लेस्ड एडवेंट, अदरवाइज सांस का प्रॉब्लम हो रहा है, धीरे धीरे जब वो कैप्टन, then you have to take the surgery, help of surgery. So sometimes dynamic pathology cause such a condition which also hampers the normal physiological phenomena. ऐसे हो सकता है. ये आपको चिंतन करने होगा, हम लोग को चिंतन करने का, what to do and what to not to do. We are permissible by our text, by our laws, and the academic bodies should think about the matter. I've told him there are two groups of peoples. Recent past, our students mobs, this हमको allow करने होगा. You like I'm practicing, we are facing a lot of troubles. Such a, for examples, poisoning case. गांव में आप लोग प्रैक्टिस करता है ना सर, होम्योपैथिक मेडिसिन एंटीट्यूट कर देगा स्नेक बाइट केस का? नहीं, आपको एंटीवेनम देनी ही पड़ेगा. नहीं सर, पॉइजनिंग हो गया, क्या करेगा? आपका वो जो प्रोसीड्योर्स, गैस्ट्रिक लावेज एंड जो है आपको फॉरेंसिक मेडिसिन, ये आपका ट्रीट करेगा. These are entered into forensic book. What is the practical utility of it? You are reading toxicology, all the things Hahnemann clearly stated here. So I went to that students, yeah, these should be permitted by Central Council of Homeopathy. I am not in favor of the antibiotics, or I am not in favor of the antacids. I am not in favor of the analgesics. But these are to be permitted. Somebody, one student told, sir, doctor, shall I permit for blood transfusion? I mean, why not? This is permissible for us. So these measurements should be applied for your daily and practice life. You trained in these ways for the practical utility. So interpretation of the 7, I think you have perceived what I wanted to say and what Hahnemann wanted to say. My explanation is there. Another word that in this position we find in the footnotes of the 141. This is under the drug proving. So first I got it, first you will get it from the aphorism 7 footnote. I know that footnotes are not properly taught. Footnotes are, there are so many markedly available textbooks. According to that, they learn. And very unfortunate to note that our teachers also followed that markedly available textbooks, never interpreted the footnotes of the organon medicines exhaustively. Otherwise, how the students will understand the organon? Therefore, the students are very much fearful, afraid of it. No, ये very cracks है, ये language कुछ समझ के नहीं ले, समझने आपको होगा, उनको अपना language समझने होगा. I know not, I want not, I thou art, but I love you because you talk in my language. शेक्सपियर बताया. हम तो आप लोग को जानता नहीं है, चिंता नहीं, पहचानता नहीं है, लेकिन तुम जो बात कर रहा है, मेरे बात कर रहा है, तुमको स्टूडेंट के, हम लोग को टीचर लोग के स्टूडेंट के बात को समझने के लिए उसको तरीका से आपको इंटरप्रेट करने होगा. Otherwise, they will not learn. A common organ subject and big words and terms are not very much helpful for the students. We have to interpret into their own language. In aphorism 141, again, we get the one that what, let it not be imagined that such indisposition, such it is under the drug proving. Please, student, those who do not have the book now at present and beside you, please consult these particular aphorisms, what I've told here, and in the library or your personally book, consult this one. Now, that such disposition caused by taking medicines for the purpose of proving them can be made injurious to the health. ये जो indisposition होता है, due to drug proving, Hahnemann बताया indisposition होता है, slightly changes about the health. You know the procedures of applying the medicine during drug proving. Ultimately, Hahnemann advised to administer the medicine in 30 potency. At the first part, he applied the juices, but ultimately, the last edition, the 30 potency, he advised that you know what are the globules uses for the proving. But I told that experience shows on the contrary, that the organism of the prover becomes, by these frequent attacks on his health due to drug proving, all the more expert in repelling all external influences inimical to his frame, and all artificial and natural morphic agents becomes more hardened to resist everything of an injurious characters. By means of this moderate experiment on his own person with medicine, his health becomes more unalterable. He becomes more robust as all experience shows. Hahnemann said, जो drug proving regular करता है, जो drug prover होता है, वो क्या होगा? There is no chance of any bad effect. He becomes robust because he can protect, prevent the so many diseases, ultimately so many influences. What we see, that a child in the younger age, in the children age, what happened? And the age continuously attacked by cough and cold and sneezing. Ultimately, what happened? Due to this, what immunity becomes occurred, and ultimately becomes very much effective for prevention of the such influences. So indisposition, when we prove the medicine, that indisposition help us, beneficial to us. So indispositions, by the way of mechanical, sometimes helpful, but if we do not turn into pathological conditions. So drug proving, therefore, the Central Council of Homeopathy made it compulsory that every intern should prove at least one drug. But I do not know how many of you practical copy ready कर हो गया है, क्या किया है, लेकिन finally I request Parbat sir, please look into the matter. Drug proving center, कुछ दवाई ऐसे है, at least जो indigenous drug है, indigenous drug को आप कोशिश कीजिए, because the belladonna is a European plant not available here. Now herbal garden में मिलता है, जो हैनीमैन प्रूव किया वो belladonna यहाँ पे मिलेगा कि नहीं मिलेगा, doubt and questions, but we are trying over there. जो हमारा हर्बल गार्डन है ऊटी में है, इवन स्वाबे कंपनी अपना बनाया, ऐसे कुछ होता है, लेकिन एटलीस्ट देयर आर सो मेनी प्लांट्स इन यूरिया प्लांट. आई रिक्वेस्ट फार्मेसी डिपार्टमेंट, प्लीज टेक प्रूव वन ड्रग. देयर आर सो मेनी ट्रीज आर देयर, so many trees are there, so many plants are there. By proving, applying, they prepare the juices and potentize it and prove it on the experiments and following the drug proving chapter, drug proving procedures. Next, another aphorism we find, if a patient of one or trivial symptom, 150, so there are 3 sources that have been observed a short time previously, the physician should not regard this as a fully developed disease that requires serious medical aid. A slight alteration. Whenever an examiner asks what is the definition of indisposition, always we quote, our students quote this particular aphorisms. Even in markedly available books, I do not name them, they also give this definition. Slight alteration in the diet and regimen will usually suffice to dispel such indisposition. There are common, uniform, universal descriptions, definition used by students throughout the country. But there is a big but. The indisposition, that is a slight alteration or condition or state which hampers the normal physiological phenomena. ये भी ठीक है, कुछ खा लिया, ज्यादा पी लिया, मैरिज पार्टी में गया, अच्छा से बिरयानी, क्या करेगा आपको? If possible, vomit it. रेजिमेंट अच्छा कर दो, ठीक हो जाएगा, डाइट ठीक कर दो, ठीक हो जाएगा. लेकिन there are so many conditions as stated in 7 considered is the indisposition are to be taken care of. These are very serious of matters. And if you consult the Kent, you'll find he said that slight alteration during menstruation considered as the indispositions. So practical utility of this every word of the organon medicines are to be understood, are to be learned, are to be perceived, and these are very helpful for the practice in the student's life, in the first part of the practice life. The time will require for doing the practice when you will develop full-fledged practice. But we should think, our teachers should think on this way that our students do not face any problem during practice choice, practical oriented. So if we understand the true, if 150, we have to understand the 151. Hahnemann 151, what it told? But 150 men he started. But if the patient complain of few violent sufferings, वहां में क्या बताया? Trivial, short time previously, पहले नहीं था. That alteration, diet and regimen. लेकिन जहां पे violent sufferings, the physician will usually find on investigation several other symptoms, although of a slighter character, which furnishes a complete picture of the disease. So 150, if you want to understand, you please read 151. So anytime that indisposition in terms into the violent sufferings. So I do not like to linger my lecture. I like to conclude my lecture because 1 hour already expired. Naturally, you will be exhausted. Sufficient bata diya. Or any questions you please put down. Or any other day you please chat me by my WhatsApp. I will give you a reply. So this is about my some clinical revelation of the indisposition, what we say or what we considered by the markedly available. कोई ज्यादा important नहीं है indisposition, वो तो disease नहीं है, लेकिन वो भी important सा है.
It was a very excellent say, sir. You have discussed very nice congenital anomalies and other topics related to homeopathy. You are gem of a person and an orator, sir. The say was very excellent. I thank you for that say. Now, Dr. Ruchi Sahu, Assistant Professor Pathology, will be giving vote of thanks. I welcome Dr. Ruchi Sahu. Yes, ma'am, please.
Good morning, everyone. I, Dr. Ruchi Sahu, would like to extend my thanks to our respected Bhav sir, GT sir, and our principal, Dr. Berber sir, with whose guidance and support we are able to conduct this webinar series. And I would also like to thank for giving me opportunity to extend my vote of thanks. A special thanks to our speaker, very respected Dr. Akhilesh Khan sir, who enlightened us today with his knowledge of indisposition with the help of a few case examples, drug proving, and as well as congenital anomalies. We are grateful, sir, to have an opportunity to hear you.
Thank you.
I would also like to thank our respected teachers, students, and the faculty members who have joined us today and made this webinar successful. Thank you so much, all.
Thank you all my teachers, respected teachers, Suma madam, Hawk madam, Jyoti Gajbe, Sanjay sir, Chaudhary sir.
So today we have got the opportunity to listen to a very good orator and a gem of a person, that was our respected Dr. Akhilesh Khan sir. Now we will be continuing our national webinar series onwards. Please note the speakers. Dr. Naveen Singh will be speaking on 28th. Then Dr. Zehra Haq, that is myself, will be speaking on 29th. Then Dr. Parth Roy sir will be speaking on 30th. And we have got a gem of a person, a unique teacher of a college, that is Dr. Nimje sir. He will be speaking on 1st December. So we conclude our program with this, and I hope you all will be patiently listening the next webinar that will be on 28th. Thank you.
Thank you.